Hi, welcome to this video. My name is Philippe Voyer. In this video, I want to answer a question that is often asked is when to use radar. And my direct answer to that is use radar with patients that are at risk of delirium. As you can see in this slide, the first step is to identify patients at risk. Among the ones that are at risk, you start a systematic assessment of delirium symptoms with radar. And also among this group, you identify which risk factors are present, such as physical restraint, dehydration, and other risk factors. And for each risk factor present, you apply intervention. You may wonder how to identify patients at risk for delirium. Well, if we look at this study in the New England Journal of Medicine, this is how they define this specific group. The patient were 70 years old or older, and they had one of the following risk factors: cognitive impairment, mobility impairment, dehydration, visual impairment, or hearing impairment. Here's another example, but this time this study was conducted in nursing homes, and they wanted to identify residents with cognitive impairment that are at risk for delirium. And in this study, this is the way they define the resident at risk for delirium. So that's why they created the group on which they would apply the preventive interventions. So the question they ask is the resident at risk? So the criteria are the following: cannot name the province, completely dependent for personal hygiene care, constantly repeats a senseless action or motion, fidgets, irritability. So to be considered among the group at risk for delirium, they had to meet 3 or more of these factors. Here's another set of criteria that you can use to identify patients that are at risk for delirium. They call it the delirium risk score, or the AWOL, and it's based on different criteria like age, the patient is unable to correctly spell a word backward, and so forth. So there are many criteria that you can use, and then you are able to identify a specific group on which you would implement the preventive interventions for delirium, but also you would use radar because this specific group is at risk for delirium. So it's really important to stress this aspect that you want to use a tool like the radar among a group that is at risk. Otherwise, if you want to use it and implement it on all patients, the acceptability and the feasibility of your project will be difficult because it's going to be too demanding on the nursing staff to do even a simple tool like radar that takes 7 seconds to do it for all patients. It's too demanding, so you have to be really specific and focus on the ones that are at risk. To come back to my initial question, when to use radar, I was very specific and clear, I hope, in my presentation to say among patients that are at risk for delirium. But obviously radar can be used as well to monitor the symptoms of a patient that has delirium. So you will be able to track the progress, or if it's getting worse, because radar can do that. You have radar that is applied in the morning, at noon, in the evening as well. So you are able to do a good monitoring of the symptoms of delirium throughout the day, and you will be able to see if it's getting better or worse. To conclude this video, I would like to remind the viewers that radar is really a screening tool, so it's really a first step to be able to detect very quickly symptoms of delirium. Then when you have a positive item on the radar, you move to the next step, which is to do the 4ED. And then if the 4ED is positive and is suggestive of a delirium, you really have to advise the physician about your results and to implement the interventions that are required by the condition of the patient. Thank you very much for your attention and your interest in radar.